Sex addiction. What is it? How can you be addicted to something that is normal behavior for most people? Coming up next on Toronto Speaks Addiction. Hi, I'm Dr. Vera Tarman and welcome to Toronto Speaks Addiction. Tonight we're discussing sex addiction. Is there something wrong with you if you want more sex than your partner? Have you ever had problems in relationships as a result of your partner's sexual behavior? Joining me tonight is Rob Peach, an associate sex therapist, and Jacqueline Thibodeau, a social worker who specializes in working with partners of sex addicts. They are both here to clear up any confusion that you may have about normal sexuality and sex addiction. Do you find it hard to control your sexual thoughts or urges? Do you wonder if you have an addiction to pornography? What would you do if you thought your partner had a sex addiction? If you have questions of your own or perhaps someone else's sexuality, please give us a call. So, Rob, let's start with you,
Sure.
because you're the guy that works with the sex addicts. What is sexual addiction, and how is it different than normal sexuality?
That's a good question. We commonly refer to sex addiction or call something a sex addiction when we have difficulties or people that we care about have difficulties in their life with their sexual behavior. Sex addiction is a term that we use to talk to one another when we're having struggle. When I think about the term sex addiction, I think about people that are having difficulty making choices consistent with their personal values about their sexual behavior.
But let me ask you a question now.
Sure.
If I have a particular view about what normal sexuality is and it's not yours, what if I say to you, you're a sex addict because you want sex more than I do? I mean, we all are individual. So what would help you so that it's not just a subjective term?
Right. So I think what you're talking about may be what we often experience in the field as a desire discrepancy, where perhaps one partner in a relationship has a stronger sex drive than the other.
Right.
And there
then
can
we'll
be
say you're a
difficulty
sex addict.
in the relationship sort of navigating or bridging that divide as a result of the desire discrepancy. Typically, when people have difficulties with their sexual behavior, it's not just within the context of their primary relationship. It's something that affects other relationships in their life. It affects their ability to interact and develop meaningful or healthy relationships with other people.
Okay, do you want to add something to that?
Well, I think, Rob, you're saying it perfectly. The idea of disconnection. Sex addiction is often highlighted by the isolation, blaming, shaming, and general sense of not feeling okay as a person and medicating through sexual behaviors. So often when people come in and the partners that I work with of sexually addicted individuals say, what is this addiction? It's neurobiological and often has little to nothing to do with sex. It actually has to do with managing painful feelings.
Well, that's very interesting, and I would like to know more about that. But first of all, I still want to get a sense, because I don't have a sense of what does it look like, sex addiction?
And I think maybe it's hard to get a sense of what compulsive sexual behavior looks like because it's very different for different people. From my model, in the work that I do, I don't typically refer to sex addiction as sex addiction. We often use terms like hypersexuality or obsessive compulsive sexual behavior.
Right.
I think the scientific jury is still out as to whether or not there's an actual diagnosis called sex addiction. We use that language because it makes sense. And we understand the language of addiction.
So one of the signs then, when you say hypersexuality, means frequent sex. But there's more to it than just that.
There can be more to it than just that. And I think Jacqueline described it very clearly when we work with individuals who are using sex for reasons other than arousal. They're using it to help them to cope with painful emotions.
Right.
They're using it because they have difficulty developing intimate relationships with others that are meaningful. They're using it as a tool of avoidance because it's difficult for them to cope with stressors in their life. So oftentimes people are engaging in compulsive sexual behavior because they're struggling to cope with what's happening in their life.
Okay. Now, so I'm still thinking because I don't know very much about this field. So there's the piece about the numbing out of emotions. I mean, I get that. That's the whole concept of addiction in general. But in terms of how would I know as a clinician, or how would a partner detect? I think this is it. So there's the excessive sexuality. But what about like like abnormal urges? Like, but you don't have it that often. It might just be once every 3 months or something like that. Would that constitute a sexual addiction, or is that something else?
I'm not sure about abnormal urges, but kind of just to speak to more of your point of getting a kind of a sense of what sex addiction is just like many other markers for addiction, which is use despite adverse consequences.
Okay.
So for instance, individuals who might be engaging in a lot of online pornography, right?
Yes.
And they lose their job over it, but they keep using. Or they've...
how would they lose their job over it?
Oftentimes, different businesses have a no-tolerance policy for online pornography, so either spending company time looking up pornography while at work, or neglecting their duties. So kind of continually using despite...
If people would actually do that.
Absolutely,
Or people struggle with developing healthy relationships with their partners. Their intimacy with their partner is disrupted because their use of pornography or other sexual behaviors makes them less available to be fully present in their intimate relationship.
Right.
Perhaps they're having sex with partners that aren't necessarily appropriate. They're choosing to have sexual relationships regardless of the consequences. Or they're acting, as I said before, in a manner that really isn't consistent with their personal values. So they're conflicted as well.
Oh, I see. Okay, so like they may themselves be trying to stop, but they can't. Like that would be somebody who is attracted to a person that they shouldn't be hanging out with, but they can't help but be attracted to that person.
Well, I think that we all have the ability to regulate our behavior. I think at times people struggle with that, and they feel that if they have a sexual thought or an urge, that sexual thought or an urge needs to be a predictor of their behavior, despite consequences, or despite really giving some thought to what their true values are.
Okay, so could you elaborate a bit more? So you were saying that using despite adverse consequences, that's, what else is another thing that would twig a person? This is sexual addiction as opposed to bad choices.
Absolutely. So trying to stop, but they can't, right? So cutting off the internet, or deleting people's contacts from their phone, getting a new phone number, trying to stop, trying to turn over a new leaf, but unable to do so. Tolerance is another indicator for addiction. So maybe again, going to online pornography, because it is so accessible and affordable and anonymous, that it's a huge problem for a lot of people.
I'll go right back to that in a second. Callers, if there's anybody here who has any questions from what we're saying now, or anything else regarding your own sexuality, this is a great time to ask. We've got a therapist that works both with sex addicts themselves and somebody who works with the partners of. So this is a great angle. Now, you mentioned, oh gosh, go back to what you were saying.
The accessible, affordable, and anonymous nature of online pornography. So oftentimes people are engaging in online pornography, starting to use more and more of it, feeling when they're disappointed themselves or a family member, feeling shame, feeling isolated, using pornography, and then starting to use different sites, different types of pornography, because they're building up that tolerance. So that's another marker.
So is it true, I've read this, but so tell me if this is true, that if you do a certain amount of pornography, you require that to get aroused, that it would then be difficult to have a normal relationship which won't be like the pornography.
And I think it's very true that some men do struggle with developing sexual relationships with partners after they've been viewing a tremendous amount of pornography. I'm going to have to ask you to hold that thought. We will be right back after the break with more interesting information on Toronto Speaks Addiction. Please get back.
Welcome back to Toronto Speaks Addiction. I'm Dr. Vera Tarman, and joining me today are Rob Peach and Jacqueline Thibodeau. Today we're discussing sex addiction. Have you ever had problems in relationships as a result of yours or your partner's sexual behaviors? Please, viewers, come on in and call in, because we're really keen to hear your questions, and we've got the experts on the panel. Now, Rob, can you go back to what you were saying about,
Sure, absolutely.
pornography,
And
I guess?
what I find with a lot of men that I, that I work with, particularly with young men,
Yes.
that view a lot of pornography, is that because they create opportunities to have their needs for connection and intimacy, almost falsely met through pornography, they don't have the opportunity, or they don't create opportunities to develop meaningful, healthy relationships with partners. So there's a period in their life where they're absent from
Right.
the usual process of
and there-
socializing with
Exactly.
potential partners.
The whole sort of beginning stage. I mean, you
Sure.
don't just immediately jump to sex. You have to do the whole talking.
Sure.
And
Sure. I mean, courtship is a
Courtship,
dated
thank you,
word,
that's the
but we
word.
still engage in courtship.
Yes,
We still
yes.
get to know one another. We develop trust. We slowly, over time, develop
Yeah.
confidence in being intimate with a partner.
Yes.
If you're viewing or spending a lot of time viewing pornography, then you're not making yourself available to develop healthier, intimate relationships.
Right.
And if you're in an intimate relationship and you're viewing a lot of pornography, that's time that you're not spending connecting with your partner in an authentic way.
Yeah. Yeah. Now, the piece about the tolerance, when a person is exposed in such an intense way, I guess that's kind of what you're saying. You don't learn how to have those less intense times, that you build things.
Absolutely. I mean, young people are being exposed to online pornography at a much earlier age and in a lot more of a volume.
Yeah.
And the template for sexual behavior is being laid, right? So this tolerance level, but also this idea of how we connect and how we have healthy sexual relationships with one another.
Yeah.
So again, going back to the tolerance, is there is neurobiological evidence of just how things circuit together if you do things again and again and again, and then you get these neural pathways that are firing so quickly.
And then you need to have that.
Absolutely.
Yeah, exactly.
And I think what's really slippery there
Yes.
is when you're developing relationships in real life,
Yeah.
you're not going to have the kind of sex that you've been watching online.
Yes.
It's not realistic.
Yes.
You're not going to have partners that are aesthetically
or that are as
ideal.
available
Or
all
as
the time.
available.
Exactly, yeah. Let's get to our call. We have
Sure.
a caller. Eleanor, thanks for giving us a call. What is your question, and who would you like to direct it to?
Maybe to Rob Peach.
Sure. Hi, Eleanor.
Hi. The question is, I was thinking society is sort of in an instant gratification mode these days, it seems.
That's kind of what we were saying, yeah.
Don't put anything off. How do you see that, I wonder, playing out in expectations about sex?
Huh.
Both regular, everyday sex and deviant sex.
Sure. And I think that it's very easy to come to expect that you're going to have the kind of sex that you would like to have if you really invest heavily in viewing pornography, or you're spending a lot of time invested in other types of sexual behavior, like paid for sex, like sex that you pay for, or less authentic, intimate relationships. So I think that it often sets people up to fail, where they feel disappointed or they feel unable to have the kind of intimate relationship that they've seen in on the internet, or they've seen in movies, or that they've created in their fantasy life. So I think that what it can do is create a real separation between what they've fantasized about or what they've idealized as the ultimate kind of sexual experience, and what true sexual experiences and true sexual relationships are like.
Yeah, I'm just thinking, and what kind of expectations does that place on the partner too? I mean, they must feel that. I mean, what would you say to that?
Absolutely. The
Yeah.
partners often that I speak to, which is the folks that I specialize working with, or the people who've been impacted by the sexual addiction, often feel so isolated themselves and feel disconnected,
Sure.
often feeling
And
that
devalued, no? Because how can they do that?
absolutely very hopeless at times because of the idea of wanting to be connected to your partner. Obviously, your partner acting out sexually in other ways, but often not with you because of that shame and that disconnection. So it feels very counterintuitive, and it feels very confusing and very shameful for the partner.
For the partner, yeah. Did you want to say?
And not only for the partner, but also for the individual that's struggling with this compulsive sexual behavior.
Yeah. Eleanor, did you want to add some thoughts that you had on this question?
Well, not exactly, but I have another question.
Sure.
Can I ask it?
Yeah, go ahead.
Okay, this has to do with smartphones and texting that are getting people. I wonder, do you see that as getting people to communicate better with their partners about sex, or does it seem to be creating barriers and distractions all the time?
Great.
You know, I think that what it actually does is remove barriers. But I don't necessarily think that that's a good thing. I think that if we're able to communicate without immediate consequence, without giving our partners direct feedback, without being physically present, then we often will say things or ask for things or, you know, create opportunity that you wouldn't necessarily create or choose or have the opportunity to develop together, because it's safer to communicate via text, and you're very likely to say things over the internet or via text that you maybe wouldn't feel comfortable or confident saying to your partner. And
That's the first time I've heard a take on how apps, this sort of thing, online removes barriers, but we actually need those barriers.
I think those barriers are helpful. If we're going to develop meaningful, healthy relationships with our sexual partners, then ideally we should be able to sit down and have conversations with those partners about our desire, about what we find erotic, about the type of sexual experiences that we enjoy. And using technology means that we don't have to have those difficult conversations, and it actually takes away that opportunity to really develop intimacy that is honest.
Let me ask you, Jacqueline, what would the partner who discovers that their spouse has been using pornography, that must be quite a shock. Like what's the typical reaction, and what would you suggest that they do?
In shock indeed, right? I think whether it's online pornography, affairs, or online chatting, whatever the discovery is of the sex addiction. Often for the partners, they feel like there's no space for them to talk about it, right? Because it's very taboo still. Addiction in general is extremely stigmatized, and especially something like sex addiction. Trying to wrap your head around that and not being able to maybe feel safe to reach out for help with even family members. So it can feel very scary and very isolating. And not to mention that if you're discovering that your partner's in the throes of an addiction, they're often blaming and shaming and doing all these denial techniques that people with addictions like to do, and that can be really hurtful.
You know, I'll often work with an individual or with a couple, and I'll ask them, who have you told about this? You know, who have you shared this with? And they'll say no one.
You mean the sex addict themselves, not
Or
the partner?
both. You know, the person that's struggling with the behavior or their partner.
Just one sec. Eleanor, is there anything else you want to add? Because I realize we're moving to a slightly different topic.
Yeah, but it's very interesting.
Yeah, it is. Well, I want to thank you so much for bringing it up. And any callers, please call in. We're here to answer your questions. The experts are here. So anyway, go ahead.
So I think I forgot where I was, but...
who have you told?
Who have you told? You know, people say no one. And I say, I'll ask, is that how you usually cope with things? And oftentimes, they'll say no. I have a very close family system. I have a good network of friends. And I don't feel able to share this with them.
Right, and I would imagine that the partner feels that too. They discovered the stash or the something, and they're probably not supposed to be on, you know. And I would imagine that they would now want to check for more stuff. So yeah, we've got the whole shame piece.
But it's interesting too, because a lot of partners also feel a sense of relief because they knew something was wrong.
Oh, interesting.
In their gut,
Yeah.
they knew something wasn't quite right.
Yeah.
Their partner had been acting, in anger or confusing mood swings, and they just felt like something just was wrong, and they'd bring it to their partner, and the partner would say, nope, everything's fine, because it's secret, right? Addictions are secret.
Yeah.
And so when it's finally revealed, there's a sense of relief, like, I wasn't crazy.
Yes.
This was real, and this was
Yes.
really happening.
Yes, something was happening.
And sometimes not. Sometimes I work with individuals and their partners will say, I didn't know.
Yeah.
I thought we had a great sex life.
Yeah.
I was very happy with our relationship.
I'm sure they'd feel like, oh, I guess he doesn't really like me.
If I wasn't
She
happy,
doesn't.
I would have said something. And that's very confusing. And as a result, people often have struggle. They think, does my partner find me attractive? Why is my partner spending time watching porn? Or why is my partner pursuing other relationships when we have a great sex life at home?
Yeah.
And what does that mean about me?
So now, is it possible that just, the person might be thinking, well, we're having a healthy sexual life, so if you're using porn, then that's a problem. Where would you say, no, that actually might be normal behavior versus not? So I know that you were talking about that it has to do with if it's disturbing function, if it's causing a discrepancy in the relationship. What if the relationship is great?
In some cases it is. I think it comes down to what individual values are.
Okay, so the partner can say that's okay.
Some partners may feel comfortable knowing that their spouse uses pornography.
Okay.
We're not here to say that that's an addiction or that's something
Yes.
unhealthy for their relationship.
Right.
It can be unhealthy if, as a couple, they don't sit down and have those conversations.
Yeah.
The absence of understanding makes for really conflicting and painful feelings when
Yeah.
it's discovered.
Do you want to add something to that?
No, I think that's well said. I think the idea is that when there's an addiction involved versus just consensual use and part of the relationship, the difference is the secrecy and the lack of communication and the shame involved. But also, usually the partner's in the dark, right? And there's a huge wedge, and that's when things become a problem.
And that's probably where you would come in.
Yeah.
So what do you see your role as in that context?
So my personal role as focusing with the partners is someone who often wants to hear their story because there hasn't been a platform in which they can share it. They felt crazy, they felt ignored, they felt confused, and now this is the first time they get to talk about it.
Yes.
I often liken it to a terrible car accident where both parties are extremely injured, and just because they weren't driving the car doesn't mean that they don't also need help, because the addiction impacts both parties.
Exactly. We talk about addiction as a family disease.
Absolutely.
Yeah. And I would think that, I don't know if it's more so than because it's such an intimate part of the couple's relationship.
And for many individuals, partners, and also for people that are struggling with the behavior themselves, it's a true betrayal. People often betray their values.
Yes.
They betray what they
Yeah.
want in a relationship. They're conflicted. They struggle with making sense or figuring out why they're doing what they're doing. So oftentimes people feel that they are betraying themselves and they are betraying their partner.
If they're engaging in this, that's right. Okay.
Very rarely is it without emotional conflict, right? People are maybe engaging in compulsive sexual behaviors that they know may be causing harm, and typically they're conflicted, they're struggling.
Okay, so callers, if anybody wants to call in, please feel comfortable to do so with any kind of question. It doesn't even have to be necessarily about sex addiction, but just sexual behavior that you're worried about or have questions about. Okay, so I got the feeling that how would a partner know? Well, there's unusual behaviors, there's the disconnect. Now they've found something, maybe they're talking about it, and they're probably going to say, okay, stop, or the person will say, I'll stop. So what happens now?
Yeah, so this is the dance of addiction, right? Wanting to stop, not feeling able to, maybe not having the right supports, not being at a
Right.
place that change can occur. So my feedback to people who've been impacted by their partner's sexual addiction is to start focusing on you. Oftentimes, there has been such a disconnection that even they become disconnected from themselves. So a chance to develop healthy boundaries, be able to build a supportive network around them, and get a handle on what sex addiction is and isn't, because with knowledge comes power, right? And being able to get a better understanding of what's happening.
Okay. Now, you had mentioned, and Rob, maybe you can give some examples, if you know, that because I found this also very intriguing, that, we use food for comfort, we use alcohol for comfort. How do you use sex for comfort if it's not for the physical pleasure of it?
I think that we all use sex for emotional regulation to a degree, even if we're in a healthy, happy, intimate relationship. Sex feels great. Connecting with a partner feels fantastic. It's exciting. It feels wonderful to have an orgasm. It's a healthy way to cope with a whole host of painful emotions.
Yes. I mean, it's an endorphin rush.
It's an endorphin
and
rush.
endorphins are our natural pain relievers.
Sure.
Yeah.
However, at times, people overuse it. People use it in the absence of other healthy coping skills.
Okay.
People use it because they don't know how to otherwise regulate emotion.
Okay. So you had mentioned at least twice about the neurochemistry or the neuro piece about that. So and here we are talking about endorphins. So okay, the person has developed a tolerance. They're using this as a way to soothe, emotionally regulate. And now what do we do? Because now the person, you're asking them to change that. What do we do?
With the person with the addiction, it's about doing some really, tough work regarding the ideas of looking at family of origin, looking at shame, looking at just sort of the pieces of how did this coping mechanism come into place? Because it usually isn't, not typically at least, well into your older age. Usually it's something that's developed at a young age as some way to kind of manage feelings.
Yes.
So looking at that, looking at healthy alternatives and different types of emotional regulation skills, but again, going to the heart of it, which is an intimacy disorder, right? And being able to connect with other people in a real and meaningful way.
Right.
I think that for some men that have struggled, it is an intimacy disorder because they struggle with connecting.
Yes.
Not for everyone. Some people can develop intimate relationships that are meaningful and rewarding and can also end up overusing sex to cope. So at times people can develop meaningful relationships and at the same time struggle with regulating sexual behaviors outside of that relationship.
Okay. We have a caller, Bill. Thanks, Bill, for calling. Who would you like to direct your call to, and what's your question?
Oh, either of the two speakers would be fine.
Okay.
My name is Bill. I'm 59 years old, and I started suffering with sexual addiction back when I was a teenager. But that's going back over 30 years now. And back then, I didn't know what really was going on with myself. I was excessively looking at pornography, and that graduated into going to strip joint places, and more pornography, the use of prostitutes, and on and on and on. But I finally did meet up with a psychiatrist back in the late 80s who had sort of, and this was a topic that no one really was talking about back then, but they put me onto a psychiatrist who had some insight into sexual addiction, and that was helpful, but really at the root of it was I have a severe anxiety problem, and I think the anxiety was played out with my sexually acting out, the inability to cope with whatever was going on in my life, right?
Right.
My main question is, though, I think that this also led into loss of a job, relationship, a lot of pain and grief, and drug abuse, and more alcohol abuse, and went along with this actual acting out. I'm 5 years sober of any kind of sexually acting out or substance abuse, but I find that because of the topic, the shame and the guilt is very difficult for me to let go, because I look at the people around me who've been consequenced by this behavior of mine.
Yes.
And it's a daily reminder why I'm living where I am, the restrictions that were placed on my children because of the financial hardships that I put them through. And if I look at it through a scientific lens, it helps give me. This show's great because it helps give me it helps give me a framework, the scientific explanation for what I went through, as opposed to a moral one.
Yeah, Bill, I thank you so much for your story, and please hang on, because I want to say something, and then I want the speakers to say something too. I'm really intrigued by a number of things you said. Let me just say one, that in my addiction work, I see a lot of alcoholics, cocaine addicts, and they put down their drug, and then they have this other addiction that they don't want to talk about, sex addiction. And the alcohol and the cocaine is first and foremost, and that's the thing that they go to treatment for. And then they're left with, now what do I do? So I'm really glad to meet both of you. One thing I'm really intrigued with, Bill, is the response that you had 30 years ago. Is it different than the response that you're getting now professionally? But I think I better let you guys give your comments. But Bill, I'd like you to come back and answer that question. I'm really intrigued. But anyway, what was your initial question? Do you want to take the...
Well, I think what Bill highlighted...
Yes, please take
or
it.
what you highlighted, Bill, is the crux of the behavior, which is often shame.
Yeah.
And when we're struggling with shame, when we're feeling insecure, we're reluctant to share, to connect with other people, and seek support, sexual behavior then becomes an even greater or more important way to cope with shame. Not only are you struggling with the sexual urges, but you want relief from the shame. You want relief from the guilt. You want relief from the pain and the struggle that you're experiencing. And in absence of other ways to cope, you're more vulnerable to continuing to engage in sexual behaviors, even if in the moment even if in the moment when you're choosing to engage, that they're harmful, it gives you relief from that suffering.
I just want to ask you now, as the partner of somebody, now I know with alcohol, the wife or the partner, the spouse, the child, even the work the friend will actually do things to try to control, which make it worse. And does that happen too, or you get this paradoxical effect of trying to do more, which actually makes the problem worse?
Such a good question, and one that actually touches on a very specific topic, which is the idea of how traumatic this experience can be for a lot of partners. And often the trauma response can be trying to control, it can be trying to disconnect, and trying to create safety again in the relationship, and sometimes the only way is that they know how, right? So that I view, and a lot of other folks out there view, having a partner who's sexually addicted can be very traumatic at times, because there has been a sense of unsafe environment within their own home. So yes, absolutely.
Bill, would you mind answering the sort of historical piece about have things changed from how you were dealt with 20, 30 years ago versus now?
Well, certainly. 30 years ago, I was involved, I had a job. Actually, I was a teacher. And we had an excellent EAP, Employee Assistance Program. And for 3 summers in a row, I went to visit a counselor because I was distressed about my situation. But when I was face-to-face with a counselor, I couldn't even verbalize. The words wouldn't even come out of my mouth what the exact problem was. I could say, yes, I drank too much, or yes, I took other substances. But the sex thing, it was just, I couldn't say it. And that was because, I think, 30 years ago. Now, today, I've since left teaching. I had to go into rehab I was in rehab for sex addiction at Homewood. And I also have been through several substance rehabs. And now I work in the field of helping people with mental health issues. So it's way more easy. It's a lot easier now to discuss addiction, even sexual addiction, as opposed to it was, when I was in the thralls of it.
Okay.
And I think, Bill, by calling in to a show like this, by sharing your experiences with other people, that's a very powerful way to confront shame. telling your story, not experiencing rejection, having people offer empathy, understanding, can be a really powerful way to help you to cope with some of those feelings of shame. The act of coming forward, making ourselves vulnerable, sharing your story, particularly when it's a story about something so stigmatized like like anyone's sexual behavior. The act of coming forward and sharing it and giving yourself an opportunity to receive positive feedback when maybe before all you've experienced was pain and suffering. It's a very powerful way to let go of some of that shame.
Did you want to add something to that, or to something else that Bill said?
Well, I think that was beautifully said. Bill, thank you. It's huge to come on TV and share something that at one point was paralyzing for you to even speak. So thank you. That's huge. And I think your message also brings some hope. So I appreciate you phoning in. Thank you.
Yeah. Bill, did you have anything else to say? And I'm really grateful that you called in.
Yeah. I still struggle with my sobriety. I still struggle with cravings. It's the path of an addict is, if you're going to try and confront change, it's work. And yeah, well, just thanks for letting me share my experiences, and I appreciate the time.
Well, Bill, then it sounds like you're about to hang up, but let me just ask you a question. Like with other addictions, we usually have some sort of therapy, which that's a great thing to move on to. But before you go, I want to ask, and often with addiction, it's not just the therapy, but it's the continuing care afterwards. It's the follow-up of support, group support, either through a 12-step program or something like that. Like right now, where you are, these many years later, and calling yourself, it sounds like abstinent, but with some cravings, where do you go now? What do you do now?
Well, I have a wellness sort of strategy, exercise, read. The work I do is like I said, I work with people with severe mental health issues, schizophrenia, to be exact. I deal with a little bit of addiction issues amongst those folks. So the work I do is so rewarding, and so that keeps me. I don't want to fall back to that behavior because I'm a role model for people who are in recovery.
Yes.
So it's a huge motivator for me.
That's great. Thank you. Bill, I really want to thank you. We have actually another caller.
Sure.
So thanks, Bill. Did you want to say any last words to Bill before I move on?
I just want to say, Bill, that the act of giving back is also a very powerful way to heal and to move forward.
Yeah.
So,
great.
Thank you.
Great. Callers, please call in. We've got the experts. And Genevieve, it looks like you have a question for us too.
Hi there.
Hi.
So I have two questions.
Okay.
My first one is, are most of the individuals suffering men?
I was going to ask the same question. Good stuff. Yeah.
Yeah, and then the second question is, would you recommend individual or couples therapy?
Great. Okay, why don't you answer the first and you answer the second?
Sure.
Great. Thank you, Jen.
So, Genevieve, I think that's a really good question, and the answer is yes. Typically, most of the clients that I see are men or identify as being male, and fewer and fewer women come through my door. So I think that part of the reason is because men are thought to have a higher sex drive, and part of the reason is I think there's still a lot of stigma about compulsive sexual behavior with women. The reality is we still live in a society that has a boys will be boys thinking.
Yes.
And there's even more shame attached to women who struggle with sexual behavior. So absolutely, most of the clients that I do see are male. I hope that might change with time and with changes in society.
And you have your own practice where
Yes.
you have a website. Do you want to just, while we're on
sure.
the subject, just give your...
Sure. So I'm a social worker and a psychotherapist in private practice, and I work mainly with men that have difficulties coping or regulating their sexual behaviors. My website is sextherapytoronto.org, and I also work with couples that have been impacted by one partner's sexual behavior.
Okay, which actually leads to you, Jacqueline. So why don't you take the second question, but why don't you, while we're on the subject, give your website and what you do as well.
Absolutely.
Yeah.
So my website is jthibodeaucounseling.com, and I specialize in working with the partners who've been impacted by sex addiction. In fact, it's something that I feel really passionate about, and did some research and wrote my thesis on the impact of having a sexually addicted partner. So it's something that's very near and dear to my heart, and I like to do a lot of research on it because of the words that we've been using so much tonight, like stigma and shame and all of these things that are really keeping really good clinicians from maybe having the information they need to help people.
Okay.
So if I could speak to Genevieve's question briefly about
Yeah.
whether or not individual or couples counseling is indicated for an issue like that, my answer, Genevieve, would be both. First of all, if your partner is struggling to regulate their sexual behaviors, then they might benefit from treatment to help them to develop skills to cope, to make decisions that are more consistent with their value of your relationship, and help them to feel like they have better control over sexual thoughts and urges rather than feel controlled by them. The other piece, though, is if you're in a relationship, or if you or anyone's in a relationship with someone that has been engaging in sexual behavior outside of the relationship and it's not been mutually agreed upon, there's been some real trauma to your relationship. There's been a betrayal of trust. There's been an injury to the attachment that you have to one another. And I think that couples therapy can be a meaningful way, an effective way, to help repair the intimacy and to help your couple or any couple that you're working with to redevelop trust.
Do you want to pick up on that?
Yeah, absolutely. I think going back to the analogy of being in a car accident, we need to get people stabilized. So the idea of going in and getting the help that you as a partner and maybe as a person with the addiction need to get grounded and to feel
So that would be the individual piece.
the individual piece,
Yeah.
right? And when I start meeting with an individual who's been impacted by a sex addiction, I say 3 really critical things.
Okay.
And these are things that I feel are just invaluable to know. One, that it's not your fault. This addiction would occur with or without you involved.
Right, it's not because you're not the perfect whatever.
Absolutely. And that you're not alone, right? This idea that we do have the internet and so much availability out there.
People aren't talking about it.
No, and it's growing. And it's this idea that it's so isolated. You're not alone. It's not your fault, and also that recovery is possible, right? So once you start to build upon those foundations, you can then bring the couple back in together. Everyone has their own way. That's one way that I subscribe to. But the idea of just really stabilizing and grounding and healing from that relational trauma.
Yeah, and then building to. Genevieve, is that? I don't know if we've lost Genevieve. Does that answer your questions?
It does. Thank you both so much.
Yeah, thank you for calling. That's great. Now we have been touching on the subject of therapy, you know, and I understand, like you've just given the individual and the group. What's the goal of therapy? Now we hear, in the context of addiction, we talk about abstinence. What does abstinence mean in this context?
You know, I think that the idea of abstinence can be a bit of a slippery idea when you're talking about sexual behavior.
Because you're not meaning you can't have sex ever again.
Well, you know, desire is like hunger.
Right.
It's something that will be with us.
Yeah.
And abstinence might mean, or the idea of abstinence means that you can't have sexual behaviors outside of the context of your relationship.
Okay, outside of the context of your relationship.
If that's what abstinence means to you.
Yeah.
My perspective is to help people to develop skills to regulate their sexual behaviors.
Right.
To
So they no
communicate
longer
with their
need to
partner.
think about the concept of abstinence?
You know, my perspective is not an abstinence-based model. It's not a 12-step model.
Yes.
It's more focused on working with individuals who want to make meaningful change, to develop skills to better cope with sexual desires.
Okay. And that's contrasting to an abstinence base. And what would that look like? Can you talk to that? Oh, and sorry, by the way, while we're talking, callers, if there's anybody who's thinking they might want to give a call, take your time. Take the opportunities. We're running out of time. Anyway, go ahead.
So I think recovery looks different for every individual
Yes.
with a sex
Yes.
addiction, right? So it's looking at your own boundaries, right? So if that means for you, abstinence means never looking at online pornography again, then that's what it means for you.
Yes.
And it's the idea of keeping some really firm boundaries, and those might be shifting as you shift and you go through your healing journey. For individuals just starting off in their recovery, for instance,
Yeah.
they might say no smartphones, no computer use, period.
Yeah.
For a year, and then we can reevaluate, see about reintegrating.
Yeah.
But the idea of recovery looking at different for all.
Yeah.
And certainly my initial approach wouldn't be to take away the cell phone or take away the access.
No.
It would make it available. Let's work on developing skills
Right,
so
so
you
that you
can
don't need to rely on-
develop
Yeah.
a healthy relationship with it.
We have another caller. Jesse, we don't have a lot of time, so ask your question, and then we'll come back after the break.
Okay, hi.
Yeah,
yep.
go ahead, Jesse.
Hi, Dr. Tarman. First of all, I will ask my question right. My question is just, is sex addiction typically harder to treat than maybe drug addiction? Because in my experience, people with drug addiction seem to have hit harder bottoms many times. And I find that typically people who've hit harder bottoms seem to have an easier time in the recovery process.
Oh, I see. So you're suggesting that with sex addiction, the bottom might not be as hard as a crack addiction, for example.
Correct.
Yeah. Well, we got a couple seconds. Does somebody want to?
I actually don't know how to answer that question, Jesse. I don't treat other addictions, and my approach is to work with people that at times who have concurrent disorders, meaning they use sex and other substances to regulate. But I don't know that I've actually read any evidence that ever compared and contrasted the two.
Yeah. Jesse, hang on, because we're going to come back to you. These are some great questions. Yeah, so we will be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. Tonight we're discussing and taking your questions on sexuality and sex addiction. And Jesse, you were asking the question about, do you have to, is treating sex addiction harder because there isn't such a rough bottom? And as I said a little bit earlier, the way that I see sex addiction is that usually once the person has put away the thing that's taken up the stage, either that's gambling, they've lost all their money, or crack addiction or something like that, or crystal meth addiction, there's a really good example. Then they discover that the sexuality is a real problem. But I don't know, I guess I have to tell you that in the work that I've done, we've not addressed that issue. Like, is it shame? Is it just lack of skills? It's really in the hands of you guys. So let me ask you, what if somebody were to actually have the nerve to call up one of you two, what would they expect? You want to start and then you take
I
it
think
up.
that I could probably speak for Jacqueline in saying that they can expect to be treated respectfully, kindly, with compassion, and most importantly, without judgment.
Yeah.
I think that shame prevents people from engaging, and our initial approach would be...
Actually, before you get on that, I just want to say, Jesse, we didn't really answer your question because we don't have the answer to your question, but is that good? Are you, is there anything else you want to say before?
Can I just say one, just one
please
quick
do.
thing to you, Dr. Tarman.
Okay.
I just wanted to thank you. I was a patient under your care at Renaissance 11 and a half months ago, and we're about to celebrate 1 year of sobriety. So
good.
Thank you for the great work that you did. I really appreciated it. And
thank you.
You were absolutely, your lecture was incredible when you came to speak.
Oh, thank you. And I hope to put a sex addiction piece into that lecture. But thank you very much for your call and your bravery to call in. So thank you. Okay. So, and by the way, callers, we got a few more minutes. If somebody wants to take a chance and give us a call, please do. And now you were saying.
So the next thing we would do is assess the situation. You know, sex addiction isn't a black or white issue. It's a spectrum of behaviors that have a whole range of negative consequences. What someone might see as problematic, other people may accept as a natural part of their sexual identity.
Okay.
Trying to understand why people believe that they have an issue that needs treatment.
Yes.
And to understand what their goals are.
Well, exactly. So what would I mean, so you're going to tailor it to each person, right? This is my goal.
Sure.
Yeah.
And the fundamental principle that we all learn in social work school and social work 101 is to start where our client is.
Right.
Our goals are our client's goals.
Yes.
We're there to join them in the journey and support them along the way.
Yes.
To offer expertise, to offer specific skill development.
Yes.
To offer education.
Yes.
And
Do you ever have a circumstance where they come in, like they do in regular addiction, where they can't, like they work for the TTC and they can't drink at all, even though, they might be able to drink moderately.
Sure.
Where, they're working in a context, maybe as a priest or something, or where they can't. But what would you do then?
And I think what I would start with is values clarification, which seems like an abstract idea, but in my experience, if people are able to clearly identify what is important to them, what gives them a sense of meaning, what gives them a sense of purpose, what gives them a sense of their own personal identity, then by helping them to make choices that are more consistent with that, they'll feel better able to make the tough choices.
Okay. Now, do you want to pick up on some of these ideas? Like people come into your office and what's your sort of...
So the idea of what is recovery and what is recovery to the individual, and what's recovery to the relationship, right? So the idea of creating safety, processing the trauma, and then getting a firm idea of what the recovery goals are, of what the idea of wellness is for the individual. And for me, I look at it through the lens too of three kind of critical ingredients: courage to talk about it, to reach out for help, the compassion needed with yourself and with the helper, and the connection, right? So I love the idea of couples therapy. I love the idea of one-on-one. I also think that groups can be really therapeutic as well, because it does break that shame stigma, and you're connecting with other people who are in a similar situation as yourself.
So where do people go for groups?
So I can do groups myself. There's also S&ON, which is a 12-step model, and that's a little bit different than the trauma model, but it's another supportive group. There's lots of online groups for partners. There's a website, Pozark.com.
Oh, yeah.
Yeah, and that has lots of resources and lots of different groups that people can be set up within their community.
Okay. Would both of you define yourselves as trauma-based sex therapists, or in that field versus the abstinence-based one? Like, I mean, what are the different models that exist? If a person comes in, they're not going to know to ask, what's your model?
And that's a fair question. My model is more eclectic, and I focus more on helping people to develop skills to cope with sexual thoughts, desires, and urges.
Yes.
And on some level, that's a macro approach, kind of trying to get a sense of what their goals are, what their personal belief systems are. On the next level, it's addressing the erotic conflict that people have. Oftentimes people have very strong sexual patterns of sexual arousal that are deeply in conflict with how they see themselves. And that can be a very painful place and very difficult to resolve that.
Yes. Now, is it possible for somebody, I mean, somebody who's grown up on pornography, which is what's happening to a lot of our young people, I mean, I'm thinking from an addiction framework here. Once you've become tolerant, hyper sexualized, is it possible to go back and just to have a meaningful relationship without getting re-triggered and wanting to go back to the old?
I think if we didn't believe that it was possible, then we wouldn't do this work.
Okay. Do you want to, can you take that, we've got about a minute left, and I want to make sure that I want both of you to get the answer to this question.
I think absolutely. I think just the science of it, that the brain's plastic can change, is hope. That we've seen change in our rooms and with the people that we work with. There's hope. And, the women that I work with, I told them, I'm going on this show tonight. What would you want other people in your situation to know?
Yeah, okay.
And they said,
Go
it's
for that.
not your fault, and that there's hope. And that was so critical to them, and that we're even talking about it on a TV show to them was so touching.
That's a great way to, what would you like people to hear?
Change is possible.
Okay.
And people can create meaningful change in their life. Chances are...
have meaningful sex that is not,
Absolutely. chances are people make more healthy decisions about their sexual behavior than not in their life. And when they're struggling, they lose sight of or connection to all of the experiences that they're proud of.
Yes.
All of the
Okay. So there is change and there is hope.
Yes.
So those are the messages that our panelists would like to give. Well, we are out of time. I'd like to thank our guests Rob Peach and Jacqueline Thibodeau. And I'd like to thank all of our callers. Thank you so much. We'll be back next month with more Toronto Speaks Addiction. Thanks for watching.